Hey, welcome back. Today we are diving headfirst into a field that's one part data science, one part detective work, and is all about keeping every single one of us healthy. Yep, we're talking about public health analytics.
I mean, really think about that for a second. How do we actually see a health crisis coming before it completely blows up? How do we get ahead of the curve and protect entire communities? Well, the answer is hiding in the data, and it's all about the people who can make sense of it.
So here's what we've got lined up. We'll kick things off with what public health analytics actually is, then we'll get into why it is so important. After that, we'll peek into a day in the life of an analyst and see how it all connects to the wider world of data science, and then, my favorite part, we're going to put you in the hot seat to solve your very first case. Sound good? Let's jump in.
Okay, first things first, let's get our terms straight. I love to think of public health analysts as data detectives. They're literally searching for clues buried in numbers to solve some of our biggest health mysteries.
At its absolute core, public health analytics is all about using information. Stuff from hospital records, community surveys, even environmental reports, to protect and improve the health of entire populations. So it's way more than just crunching numbers in a spreadsheet. It's about turning those numbers into real actions that can literally save lives.
And that leads us to the biggest question of all. Why does this work matter so much? Well, the mission here is just massive. It's all about protecting the health and well-being of our communities on a huge scale.
For instance, these are the folks who track flu trends to see a spike coming, or pinpoint which neighborhoods are in desperate need of more health resources. They're the ones who figure out if a big public health campaign is actually working. And they provide the cold, hard evidence that politicians need to create smarter health policies. The bottom line is, their work directly impacts all of our daily lives.
Okay, so let's get practical and see what this looks like on the ground. What does a day in the life of one of these data detectives actually involve?
And hey, let's talk about the career itself for a sec. It's not just a feel-good, mission-driven job. It's also really professionally rewarding. With a solid average salary and growing demand, this is a field where you can truly make a difference and make a good living while you're at it. A typical day pretty much follows a clear investigative path. First, you gather the clues, pulling in all that raw data from tons of different places. Then, you connect the dots, running your analysis to find those hidden trends and patterns. Step 3 is building the case. You create charts, maps, and reports that tell a really clear story. And finally, you inform the team, presenting your findings to the people who can take that insight and turn it into real-world action.
Now, if that whole process sounds kind of familiar, you might be thinking of data science. And you'd be totally right. The tools are often exactly the same. The huge difference, though, is the mission. Let's break it down this way. A general data scientist might use their skills to help a company sell more stuff or increase profits. A public health analyst uses those exact same skills, but their goal is to improve community health. See the difference? The impact isn't measured in dollars and cents. It's measured in lives saved, diseases prevented, and communities made stronger. It's basically data science with a public service heart.
All right, enough talk. It's your turn. We've gone over the theory, so let's put you in the driver's seat. Let's solve a case together.
So here's the scenario. All of a sudden, emergency rooms across the city are seeing a huge spike in visits for asthma attacks. Something's going on, but nobody knows what. As the analyst on the case, it's your job to figure it out.
So what's the first step in any investigation? You gather the evidence, right? You pull all the ER data, sure, but you also start looking for other puzzle pieces. How's the local air quality been? And what do we know about the specific neighborhoods these cases are coming from? Next, you start trying to connect the dots. And then, bam, you plot the asthma cases on a city map, and a super clear pattern just jumps right out at you. There's a major hotspot, a cluster of cases, all concentrated in the neighborhoods surrounding a large industrial factory. This is that classic aha moment for a data detective. And finally, your findings lead to action. You don't just point and say, hey, there's a problem over there. You build your case with a clear, data-backed report. You recommend specific, targeted solutions. Let's get more air quality monitors set up near that factory. And let's open up community health clinics in those neighborhoods to give people immediate support. And that is how data drives real-world change. You know, this quote from Carly Fiorina just says it all, doesn't it? The whole job of a public health analyst is to take raw, messy data, shape it into clear, understandable information, and ultimately provide the kind of powerful insight that helps leaders make life-saving decisions. So, that leaves us with one last big thought.
I mean, from understanding mental health trends to figuring out the health impacts of climate change, the mysteries out there are endless. The real question is, what's the next big thing we're going to uncover with the power of data?
And that's a wrap on our tour through the world of public health analytics. If this helped you see the incredible power of data in protecting our communities, we'd love it if you'd let us know in the comments. We're always looking for the next topic to break down for you. Thanks for joining us.